And one of the areas that we find can be particularly challenging, or one of the things, should I say, that can really derail this intricate harmony of aspects that need to come together is pain. Pain is something that can really, really be have a very negative impact on particularly a woman or a couple who are trying to conceive. Pain, what we need to understand about pain is it is not a one-dimensional issue. Pain is multifactorial. Pain can be coming from physical injury and trauma to actual tissue, but it can also be from behavioral patterns, depending on how the individual perceives their pain. It can be a mental cause of pain. And have quite deep psychological effects on a person, which then in turn becomes an issue in their body and builds into that negative system, derailing the course that we're trying to be on. So when we are looking specifically at pain and fertility, we are really focusing around the pelvis and the pelvic structures. In particular, we are looking at sexual and genital pain. And these can be looked at in sort of different ways, more specifically to the actual anatomy around the perineum, the vulva, but then also into the actual structures of the pelvis itself, the organs inside, and then this musculoskeletal tissue around that. And the pelvis is an incredibly special place for females because there is so much function that happens there. On a biomechanical level, our pelvic structures, our pelvis, the bony structure, gives us some stability. The muscles give us our biomechanics, which communicates with our core muscles and the rest of our body to basically allow us to move and perform daily functions every day. But then also the functions of the organs inside the pelvis each have an individual role to play. They're all linked together and work together, but also have their own uniqueness. We're looking at the bladder for our urinary function, the uterus and vagina for our sexual and reproductive function. Our bowel is our bowel movements and basically having poos. So all of these organs are all like a little family that live together in the pelvis. And what we often find, as one knows when they live in a family, that if someone in the family isn't happy, there generally tends to be a bit of a discord and a bad energy amongst everybody else. So often symptoms are quite interlinked with these bodily functions.